Hello, welcome once again to Smartness Tutorial. Today we want to look at one important condition which affects about 10% of the world's population, and that is peptic ulcer disease. And so the peptic here comes from the Greek word which is known as the pepticus, and which means that to be able to digest. And so in the digestive system, we have certain things that help to digest our food, and one of the enzymes is known as the pepsin. And so you can relate why it is known as the peptic ulcer disease. Now let's look at the clinical definition of peptic ulcer disease. So we said it's the ulceration or the excavation or the hollow out of the mucosa lining of the GIT as a result of the imbalance between the digestive systems and the hydrochloric acid and the protective mechanism. And so this is the clinical definition of peptic ulcer disease. Or someone will say that it is the breakdown of the mucosa lining of the GIT as a result of imbalance between the hydrochloric acid, digestive enzymes, and the protective mechanism. Now let's try to understand the key terms in this definition. And so one is the aggressive and the protective mechanism. Now I term the hydrochloric acid and the digestive enzymes as the aggressive factors, and then the protective mechanism. And so within the mucosa lining, so this is the structure of the stomach. The mucosa lining is this one. There are certain things that protect the mucosa lining from the corrosive activity of the hydrochloric acid. We all know that hydrochloric acid is corrosive in nature, and so when it gets onto the mucosa lining, it begins to erode it, or begins to cause the ulcer or the sore that we are talking about. Now there are certain factors that help to protect the inner lining of the mucous membrane, and which are termed as the protective factors. And so as we move on, you look at some of these substances that help to protect the inner lining. Now we also said that there is another thing called the mucosa lining of the GIT, and so that means that peptic ulcer disease affects the GIT. But is it all part of the GIT? Because with the GIT we have the mouth, we have the esophagus, we have the stomach, we have the intestines. But when we talk about the peptic ulcer disease, we are looking at certain sections. An example is the esophagus, the stomach, and then the duodenum. And so the esophagus here, the stomach here, and then the duodenum. And that is the main areas where ulcers affect. And so that means that we have three main types of peptic ulcer disease. And so when it affects the esophagus, we call it the esophageal ulcer. And when it affects the stomach, we call it the gastric ulcer. And when it affects the duodenum, we say it is known as what? Duodenal ulcer. And so then we have the esophagus here. It can affect this side, and then it can also affect the stomach here, and then it can also affect the first part of the duodenum, which makes the three types of peptic ulcer disease. Now remember we said that the ulcer or the sore of this GIT occur because of imbalance between the aggressive factors and then the protective factors. So let's look at these aggressive factors. So the aggressive factors are the things that can cause the ulcer, or the things that can erode or cause erosion of the mucosa lining. An example is the hydrochloric acid, the pepsin, which is being one of the juices that helps to digest proteins. And then we also have the bile, we have the NSAID, we have the alcohol, and then we have the smoke. And so that means that NSAID can cause peptic ulcer disease, which means that a patient with peptic ulcer disease who is knowing in pain should not be given NSAID, because it can aggravate the condition. And follow us for you to understand why a peptic ulcer patient should not consume or should not take NSAID for treatment. If you have not subscribed, please take your time, subscribe, share, and then make your comment. Now let's continue. Now, so it as is shown on your screen, the stomach, and then within the stomach we have certain cells which are found within what we call the gastric pit. So we have certain cells which are found within the mucosa. Now you all know that the stomach has 4 layers. So let me put something here. So we have the mucosa lining, we have the mucus, we have the muscularis, and then we have the serosa. Now within the mucosa lining, we have certain cells, and these cells are found within a certain pit known as the gastric pit. Now within this gastric pit, we have several cells that helps in the production of the hydrochloric acid to be released into the lumen of the stomach to aid in digestion. And so this is the pit that I'm referring to, which is also shown on the screen. Now I'm going to bring in this pit here. Within the pit, at the topmost is where we have the mucous cells, and then we have the chief cells, we have the parietal cells, we have the G cells, we have the D cells, we have the enterochromophone cells. But I want to bring the enterochromophone cells here, enterochromophone, which is usually shortened or abbreviated as ECL. Now, I want us to understand the mechanism between the acid production and its regulation, and then from there we will look at the factors or the risk factors to peptic ulcer disease. So now first let's try to understand how this acid are being produced and then released into the lumen of the stomach. So we have one cell which is known as the G cells. Now what is the role of these G cells? The G cells secrete an enzyme known as the gastrin. And what does this gastrin do? The gastrin stimulates, so when the gastrin is being produced by the G cells, the gastrin now come and stimulate this ECL, which is the enterochromophone cells. And the enterochromophone cells will also release a certain hormone which is known as the histamine. Now, so when this histamine is being released, they go and bind on the receptor cells. So on the parietal cells, we have receptors that is mainly for histamine, which is known as the H2 receptor. And so the histamine will now bind to the H2 receptor to stimulate the parietal cells to secrete the hydrochloric acid. So the parietal cells will now produce the hydrochloric acid, and then it will now be pumped into the lumen of the stomach. And so we have our hydrochloric acid here. Now, another factor which also helps in the production of hydrochloric acid is our nerves. So let's assume that this is a nerve, and we know that within the submucosa there are certain nerves which is known as the vagus nerve. So we have the vagus nerve here, which is parasympathetic in nature. Now, when the vagus nerves are being stimulated, the vagus nerve can be stimulated by maybe stress. Okay, maybe someone is hungry and that person is anticipating or waiting for food, craving for food. The vagus nerves will be stimulated, and when the vagus nerves are being stimulated, they also release what we call the acetylcholine. This acetylcholine also helps in the production of the hydrochloric acid through the parietal cells. Now, how does it do that? The acetylcholine can directly bind with the parietal cells binds with the parietal cells directly and stimulates the parietal cells to produce the hydrochloric acid to be pumped into the lumen of the stomach. Or it will stimulate the enterochromophone cells, and the enterochromophone cells will also release the histamine, and the histamine will now bind with the histamine 2 receptor on the parietal cells to produce hydrochloric acid to be pumped into the lumen of the stomach. So that is also one way which hydrochloric acid are being produced. Then we also have another cell here which is also known as the chief cells. Now the chief cell here also release or secrete an enzyme which is also known as the pepsinogen. Now this pepsinogen also, when it is being released, binds with the parietal cells to produce the hydrochloric acid to be released into the lumen of the stomach. And so when we are talking about peptic ulcer disease, it means that anything that will stimulate the parietal cell to produce excess amount of hydrochloric acid, which is more than the protective mechanism over here, the acid is going to cause erosion of the mucosal lining, and that will lead to ulcer. Now that is the production of hydrochloric acid. Now let's try to understand the regulation. So remember I said that when there's an imbalance between the protective factors and the digestive enzyme, that is when we have the peptic ulcer disease. So now let's try to understand how the body try to regulate the acid production. Now one of the way in which the body tries to regulate the production of acid is through the mucous cells, which is found on top of the gastric pit. Now we learned something in inflammation, that in inflammation there is a vasodilation which leads to the release of inflammatory chemokines, and one of the inflammatory chemokines is the arachidonic acid. So we have arachidonic acid. Now with arachidonic acid, it leads to the production of what we call the COX, which is the cyclooxygenase 1 and the cyclooxygenase 2. Now when the cyclooxygenase 1 is produced, it also leads to the release of prostaglandins. And then these prostaglandins that we are interested in are the prostaglandin P, J, E2, and then the I2. So prostaglandins are very important when it comes to regulation of acid in the lumen of the stomach. How does it do that? And so when arachidonic acid are being produced from inflammatory process, there is a release of COX, which is the cyclooxygenase, and then the COX also leads to the production of prostaglandin. Now, prostaglandin helps in regulation of acid production. How does it do that? It does this through two mechanisms. One, prostaglandin stimulates the mucous cells over here. So we have prostaglandin PGU2 or the I2, which can stimulate these mucous cells, and then they will produce mucus, which contains. So when they stimulate the mucous cells, they produce what we call the mucus, and this mucus also contains bicarbonate. And we all know that bicarbonate, with the previous video we said that bicarbonate is what? An alkaline substance which comes to neutralize the acidity of the mucosa line. And then again, the mucus also serves as what? A protective barrier by lining the mucous membrane so that the corrosive nature of the acid and the digestive juices will not be able to cause erosion of the mucosa lining. So that is one way which the prostaglandin helps in protecting the mucosa lining or preventing the acid from damaging the mucosa lining. Then now, again, another way which the prostaglandin also help in protecting the mucosal lining by inhibiting the parietal cells from producing more hydrochloric acid. And so the prostaglandin here, so let me put it here. Let me prostaglandin PGE2 here will come and bind to the parietal cells. And on the parietal cells, we have certain receptors that are mainly for the prostaglandin, which is the muscarinic cell, so receptor cell. So they come and bind to the muscarinic receptor cells on the parietal cell to inhibit the parietal cell from secreting or producing hydrochloric acid. Or in another way, they also binds with the enterochromophone cells to inhibit the release of histamine. And we all know that when histamine are being released, they go and bind with the histamine 2 receptor to stimulate the parietal cell to produce what? Hydrochloric acid. So this is the way the body produces hydrochloric acid and also regulates the hydrochloric acid. Now, understanding this physiology, then now let's try to understand the risk factors to peptic ulcer disease. So when we talk about risk factors of peptic ulcer disease, we are just trying to look at a situation whereby the parietal cells are going to be stimulated more to produce more hydrochloric acid and then less mucus production. So let's look at one, NSAID. As excessive intake of NSAID. And NSAID we have diclofenac, brufen, and co. Now, let's try to understand. We say NSAID is known as a non-steroidal anti-inflammatory. So NSAIDs are against inflammation, and we just learned that in inflammation there's a release of arachidonic acid, and the arachidonic acid will produce COX, and the COX or the cyclooxygenase will also produce prostaglandin, and the prostaglandin will either inhibit parietal cells activity by preventing from producing too much hydrochloric acid, or stimulating the mucous cells to produce more mucus, which will help to protect the mucosal line. And so when we take NSAIDs, which is against inflammation, it means that you are stopping the production of what? Prostaglandin. And that means that you're going to have more of the hydrochloric acid within the lumen of the stomach, and that will lead to the erosion or the ulcer of the mucosal line, leading to what? Peptic ulcer disease. And then we also have another drug which is also called steroids or corticosteroids. So any drugs that contain steroids, like the prednisolone, dexamethasone, all this drug also reduces inflammatory processes, and that means that we are not going to have prostaglandin that will help to inhibit the parietal cells activity or lead to the production of what? Mucus cells. And so today we know that when a patient is having peptic ulcer disease, no matter the pain, we are not supposed to give the patient what? An NSAID containing drug, or no matter the inflammatory process that the patient is experiencing, we don't have to give steroid containing drug to this patient, because that can worsen or exacerbate the pain. Now, another risk factor, we are talking about risk factors. Another risk factor to ulcer disease is stress. Now, how does stress cause peptic ulcer disease? And so we just learned that when we are being stressed up, the vagus nerves are going to be stimulated. So maybe someone is hungry in anticipation for food. Maybe the person is craving for food. The vagus nerves are going to be stimulated, and they will release the acetylcholine, and the acetylcholine will now bind to the parietal cell to produce hydrochloric acid, which will now go and cause erosion of the mucosal lining, leading to peptic ulcer disease. And so the stress is not only about physical stress, it can also be about what? Emotional stress. When you are stressed out, these vagus nerves are going to be what? Stimulated. Or maybe you are hungry and you are waiting for food. All these things are also what? Stress. Now, another one which is also hunger can also predispose, or fasting can also predispose someone to peptic ulcer disease. How does this thing happen? And so you are not eating, and remember, your hydrochloric acid are being produced, and when they come and they don't meet any food, they begin to chop or erode the mucosa lining. And even what is even more dangerous is that you are hungry and then you are chewing gum, which does not contain any food substance. And so when you are chewing the gum, the saliva that is entering into your stomach will stimulate the vagus nerves, and they will also produce the acetylcholine to stimulate the parietal cells to produce hydrochloric acid to be pumped into the lumen in waiting for food to digest, and they will not meet any food, and then they begin to digest the mucosa lining. Now, another factor which can also lead to peptic ulcer disease is alcohol. Now, alcohol is also corrosive in nature, and so when you take in alcohol, they also try to cause damage to the mucosa lining, which contains the epithelial cells. Then another thing that can also lead to ulcer is smoking. Now, smoking can lead to ulcer in various ways, but one of the commonest one is by constricting or damaging the blood vessel, which will limit the blood flow to the mucosa lining. We know that the mucosa lining is made up of what? Epithelial cells, which are being replaced every 3 days. Every 3 days, the epithelial cells are being replaced in order to be able to withstand the corrosive nature of the hydrochloric acid. And so when you are not, so when the enough oxygenated blood is not getting to the mucosa lining to help in the regeneration of these epithelial cells, then the individual will be at risk of peptic ulcer disease. And so I believe that this lecture has helped you to understand peptic ulcer disease. Now, if you have not subscribed, please subscribe, comment, and share, because in the next video we'll be looking at the differences between the 3 types of ulcer that we talk about, and then we also look at the pharmacological and the non-pharmacological treatment of peptic ulcer disease. Thank you. Bye bye.